this procedure that he's offering, it works.
And after a couple of treatments, I started seeing noticeable results.
Hi, this is Dr. Andy Barlow with the Chiropractic Neurology Center of Tupelo, and thank you for joining us for our half hour to health. In today's segment, we're going to be talking about chronic degenerative knee pain. We're going to have multiple patients that come in with a myriad of knee pain problems, some chronic, some recent. Some of these patients have come in crutches or a walking cane, and they no longer need their crutches or their walking cane. Some of the patients that come in, they were concerned because they couldn't go and play with their grandkids. They couldn't go to a ball game because of their knee pain. They couldn't climb upstairs or go downstairs, or even when they sat down for 30 minutes, they had a difficult time standing up and the embarrassment that they felt from not being able to move. So today, in the next 30 minutes, if you have chronic degenerative knee pain, you need to call our clinic and see if we can help you, because in our clinic, we guarantee results within 2 visits with chronic knee pain, which means that we can rule you in for care or rule you out for care in 2 visits. So again, we guarantee results within 2 visits, or we don't accept you for care. I hope today that you enjoy this 30 minutes that you're going to spend with us, and right now we'll segue into a patient testimonial. Today we're talking about our 30 minutes to health segment, and Mr. Penny, I want to thank you so much for being here today.
Yes, sir.
And Mr. Penny is one of our patients that suffered from chronic knee pain for years. Would that be a true statement?
Yes.
Okay. And basically, he's going to tell his story about how long he's had the problem. And Mr. Penny, just take it away for me and tell me about your knee. I know you retired,
Yes.
and you are retired. Just tell me about your knee. How long have you had the problem?
Dr. Barlow, back in the 70s, I was in a horrific automobile accident, and I believe that's where the symptoms set in.
Okay.
But then I had a wonderful career as a park ranger with the National Park Service and a very aggressive exercise program and requirements. And the pain was not an issue at that time. But when I took an early retirement at age 57, the pain set in, and the pain ended up in my knee. And it was chronic, and it was very disturbing, to say the least.
And what was it that was the most debilitating about your left knee problem?
Well, the pain was all-encompassing. I couldn't sleep. The pain was just there all the time, and it required focus, mental focus.
And with you being an athlete, I mean, we can clearly look at you and tell that you're in shape. I mean, how did it impede your ability to work out and those kind of things?
In all ways. Well, first of all, my mind was constantly focused on my knee. I couldn't sleep because the pain was there all the time. Roll to the left, right, back, tummy. The pain was always there. Just always. I was always trying to get in a position where the pain would be relieved, and it couldn't be done.
Well, what was it too, Mr. Penny, that frustrated you the most about at 57? Having this knee pain, what frustrated you the most about that?
Well, not only the pain, I could live with the pain, but just getting in and out of a vehicle was difficult. Going up and down stairs was a challenge. I was dragging my foot and tripping. It was, and my family, my children was asking my wife, what's wrong with Dad? Why is he in pain? And I didn't know, and I was scared.
Yep. And I know when you came in, I think you were more fearful than anything else, because you were just, I have this pain, I think I know where it's coming from, but I'm not getting any help from anyone. And when you came into the clinic, we did a neurological exam, and then we took x-rays of you.
Yes.
And then we went over a care plan.
Yes.
And could you tell just the folks that are watching here today at our half hour to help, how long did it take us to actually start to see results with this knee problem that you had that was a chronic knee problem?
Well, almost instantly.
Yep.
Once we saw the x-ray and the condition of my spine, and you identified where the pain was coming from, the source of the pain, all of a sudden I had mental relief, and then we started pursuing physical relief. And after a couple of treatments, I started seeing noticeable results.
Okay. And if anyone that's watching here today that has chronic debilitating knee pain, that's fearful about where their life is headed, I mean, just look in the camera and tell them what would be your opinion about them coming in here and changing their life?
Please do it. I know what it's like to be in chronic pain. When I see a person limping or I know they're in pain, and I really believe Dr. Barlow can help, not only his treatments, but his physical therapies, the way he works, the muscle groups and the nervous system is unbelievable, and I got results, and I have a life, and now I'm not worried about the pain, and I'm worried about having a wonderful day and what I'm going to do today, and why the day is so short. And the pain is not there, and I need to retrain myself. Why am I limping? Because the pain is not there, so let's stop limping.
Right.
And I could go on and on, Dr. Barlow.
Well, Mr. Penny, I thank you so much. It's been a wonder. You're just an incredible patient, and I thank you so much for being here today. And really, it's by you giving this testimonial, you just never know how many people's lives you're going to touch just by being here, because people are at home right now just going, I've been to doctor after doctor, I've had some shots, I have painkillers, none of that seems to work. And we're going to be talking more in our half hour to health about other patients and their testimonials about having chronic degenerative knee pain, and we'll have more patients shortly. Thank you very much. We're fortunate enough to have Miss Miller here with us today, and Miss Miller came to our clinic with chronic knee pain, and I believe she had right and left knee pain, correct, Miss Miller? And how long had you had the knee problems?
About a year.
About a year. And on a scale of 1 to 10, 10 being so bad you can't stand it, where would you, and 1 feeling great, where would you describe the intensity of the pain?
A 10 on the left knee.
Okay.
I even made a trip to the emergency room one night.
Okay, and tell us about that. What happened?
They did nothing.
Okay. And okay. And so you've had the problem for a year, and what was the most frustrating part about having this right and left knee pain? What frustrated you the most about it?
Well, I couldn't get up and get around real good.
Okay.
It hurt.
Okay. And how did it affect your job?
Same thing.
Okay, you just couldn't get around?
Yeah, it was
Okay.
hard to get around.
Okay. And,
Very painful.
And so how did you hear about us?
Actually, through a friend of mine that had been here.
Okay, and referred you to us. And,
Yes.
And so when you came into the clinic, we did a neurological exam on you.
Yes.
And then we sat down with you and showed you your x-rays and said, Miss Miller, this is what's wrong.
Yes.
And then we went over our best recommendation with you. Remember all that?
Yes.
And I said, here's step by step what we have to do. And you've had this problem for a year. You've been to the emergency room, and then you come into our clinic. And how many treatments did it take before you started to notice improvements with your knee pain?
The second treatment, I noticed improvement. By the third, I was totally out of pain.
Okay. And I mean, how does that make you feel that it's like in 3, well, I don't know. I mean, I don't know.
It's like day and night.
Okay, because you have a person that's in chronic pain and then within 3 visits. Because when I tell a patient that I guarantee results with knee pain in 2 visits or I don't accept them for care, it kind of shocks people. But with this neurological treatment system that we have and using cryogenics and the advanced therapies that we have, I mean, you're not an exception to the rule, you are the rule. And I mean, you've been in here long enough to know that you see people coming in here and they get these kind of results within 2 visits. And so how going from that level of a 10 to being almost pain-free, how has that changed your life?
It's, like I said, like day and night.
Okay.
It's great not to be in pain.
Yeah, and so I just I want to thank you so much for being in here. And if you had somebody, just look in the camera and just tell people what you think. If somebody has pain and they're at home watching this half hour to health, what would you tell them if they had pain about coming in here? What would you recommend them do?
I would recommend they come because, I mean, it works. I've had several friends come here, and then of course I came. And it works, and it's a better alternative than surgery.
Yes, ma'am. And so I want to thank you for being here with me today.
You're welcome.
And one of the things too that I would like to say is that when a patient comes into the clinic, we're going to do an examination, a neurological exam. We're going to take X-rays, and then I'll set a patient up on my best recommendation. And the reality of it is, it's our office policy that if we do not get results in 2 visits with a person with knee pain, we do not accept them for care. And what we're going to do next is I'm going to go through several of the advanced therapies that we have here at the Chiropractic Neurology Center of Tupelo to show you at home some of the therapies that you would be on if you came into the clinic to get help in our clinic. Okay, now what we want to do is we want to talk in detail about 3 different patients who came into our clinic suffering with chronic degenerative knee pain And all 3 of these patients, even though they had the same exact symptoms, we had to use 3 different protocols for each individual patient. Let me kind of explain what we were talking about here. I've got one of my patients who is under care, and he had trauma to his knee due to a football injury. And here's the amazing thing. This football injury happened in the 1950s. So when we're talking about chronic problems, I mean, my goodness, this guy has had knee problems longer than I've been alive. So what happened, he had a football injury, he had knee surgery, and he did well after the knee surgery for a few years. But the problem was that with this knee surgery, with the scar tissue, the pain came back. And of course, with the pain coming back, the doctors were wanting to have surgery and inject his knee, and he goes, I'm not gonna have surgery again. And so he comes into our clinic and he says, Doc, do you think you can help me? And this is exactly what I tell every single patient that asks me that has chronic knee pain, do you think you can help me? And I tell them, if I can help you, we're gonna know in 2 visits, because if I can help you, you'll know in 2 visits and I'll accept you for care. And if I can't help you in 2 visits, I'm not going to accept you for care in this clinic, and you may need surgery. So in this particular scenario, football injury, trauma to the knee, and it took me 2 visits for this patient to realize that I could help him. And here's the amazing thing. He's an avid golfer, doesn't have a problem going and golfing anymore, and he said the only time that my knee hurts me anymore is when I'm actually walking down stairs. So walking around the house, no problem. It doesn't wake me up at night. I'm sleeping all the way through the night now. I can go upstairs, but just when I go downstairs, it bothers me. And he's very happy with that, and I'm very happy as well. Now let's talk about a completely separate case where a patient, and I'll ask you when you come in, what is it that caused this problem? Because if you've had trauma to the knee, you know what caused it. But most of the patients that come in with chronic knee pain, I ask them, what caused this problem? And they're like, I have no idea. I just woke up one day and I had knee pain, and 10 years later I'm in your clinic. And doctors want me to have surgery, or they want to inject something into my knee, or they want me to do painkillers, and none of those are working. I mean, when patients come in and they've had knee replacement surgery and it works, I don't see those people. People who get injectables and those work, I don't see those people. I see all the people that failed at knee surgery, failed at injections, and failed at painkillers. And those are the people that I'm here to help. But let's talk about this next patient. This next patient came in, and what's important is there is a set of nerves that come out of your back right here at lumbar spine 2, 3, and 4. Now the reason this is important is because this is called the femoral nerve. Now the femoral nerve, the reason this is important is because the femoral nerve, if we can look down here at my little friend with the knee, we have several muscles here, rectus femoris, vastus lateralis, medialis, sartorius, and vastus intermedius. And those muscles get their nerve supply from the femoral nerve from the lumbar spine. The problem with this is when we get femoral nerve damage, these muscles become extremely weak. They become what is called hypotonic. And when a muscle becomes hypotonic, the joint gets extremely sloppy. So this femur, which you can't see the bone here, but the femur, what it does is it can't stay stable on the tibia, and we get these micro shears and micro tears, and 5, 10, 15 years later, you're in my clinic because you have chronic degenerative knee pain. So with this patient, we had to work on their back to fix the femoral nerve, fix the knee. Third patient. The third patient that came into the clinic is, here's what she had. She had back pain, she had knee pain, and she also had foot numbness. Now, the common denominator with back pain, knee pain, and foot numbness is L5. L5 nerve root comes out of your lumbar spine at the lowest level in the lumbar spine. It can go to your back and cause back pain. It can go down to your knee and cause knee pain and numbness and tingling in your foot. Actually, L5 nerve root controls all of the sensation in your toes except for your small toe. So as soon as I asked the patient what caused it, she said, I'm not sure. I said, tell me the symptoms, back pain, knee pain, and numbness in the foot. And I said, well, you probably have an L5 nerve root problem. We did an exam to confirm it. We took x-rays, and yes, she had an L5 nerve root. Now, why is it concerning with L5 for a knee pain problem? Well, on the back of the knee, there's a muscle that's called the popliteus. And the popliteus is the muscle in the back of your knee that unlocks your knee every time you take a step. Now also the popliteus, with this big bone up here called the femur, it actually, every time you take a step, it keeps the femur from shearing onto the tibia bone. So if we have L5 nerve root problem, we can have back pain, we can have knee problems because of the popliteus, and we can also have numbness and tingling in the foot. So we have people that came into the clinic, they all had the exact same complaint. Doc, my knee or my knees are killing me. It's been going on for years to decades. And each one of these patients, I had to take a completely different approach to solve this problem because one had trauma in the knee, one had a lumbar spine problem at L2, 3, and 4, and the other patient had a problem at L5. So the beautiful thing in this clinic is whether you've had trauma in the knee or it's a lumbar spine that's causing the problem, we have the advanced modalities to actually be able to help you if you're suffering from chronic degenerative knee pain. Also, in closing here, before we break away to another testimonial, I would like for you to go online to YouTube and YouTube Dr. Andy Barlow knee pain. I have numerous patients in my clinic in which I videoed before and after, and it would be best if you would actually look at some of these videos before you come into the clinic. So thank you for spending this time with me. Again, I wanted to talk about 3 main problems that a person can have with chronic knee pain: trauma to the knee or a lumbar spine problem, and we have to have different modalities to treat each one of these conditions. Now, what we're going to do is we're actually going to break away to some other patient testimonials, and I can't say this enough. If you have chronic degenerative knee pain, I need 2 treatments to see if I can help you. We guarantee results within 2 visits with chronic degenerative knee pain, and if we don't get results, we'll refer you out for surgery, and if we do get results, we'll see you as a patient. Let's go to our next testimonial. We have today with us Ms. Harbin. Ms. Harbin, thank you so much for being here with us.
Thank you.
And Ms. Harbin is suffering from knee pain, and I believe it's right and left knee pain. Is that correct?
Yes.
Okay.
Yes.
And basically, I'm just going to ask her a few questions, and she'll tell you her story. And Ms. Harbin, could you tell everyone how long had you had knee pain before you came into the clinic?
I've had knee pain about 2 years.
Okay.
Yes, I would say about 2 years.
Okay. And then how many doctors have you seen for this?
I've seen 2.
2 doctors. And
You're the second one. The
second doctor. Okay. And what did the first doctor, what did they recommend? Was it shots, surgeries, or what was it?
Well, they diagnosed it as arthritis.
Okay.
And I did get a couple of shots of, what was it? I can't think of the name of the shots that they gave me. But they gave me 2 shots in my knee, 1 shot in my knee.
Okay. And did they work?
It didn't work.
It didn't work. Okay. The reason I was asking if it worked, because sometimes they work, and if it's the first one, if it's going to work, usually it's the first one, and it lasts the longest. I've had people that's had as many as 3 shots in their knee. The first one may work, and the second 2 didn't. So I'm just wondering about that. And on a scale of 1 to 10, when you came in here, 10 being so bad you can't stand it, and 1 you feel great, how bad were your knees?
When I came in here, I would say my knee, I was about 4.
About a 4 on a scale of 1 to 10? Okay.
Yes, on a scale of 1 to 10, I was about a 4.
And how disabling was that?
That was very disabling. I couldn't bend. I could not bend. I could barely walk. I couldn't wear heels.
Okay. Those are important.
Those are very important.
Wearing heels are very important.
Yes.
And then whenever you came into the clinic, we did a neurological exam on you.
Yes.
And then we took x-rays of your spine and your knee to see what's going on. And then I sat down with you and I spelled everything out, and I said, this is the therapies that you're going to need. This is my best recommendation. And then I said, well, we expect to see results in 2 visits. And
Yes.
then when you came into the clinic, how long did it take before you started seeing results?
I started seeing results, I would say the second to 3rd week, I started seeing good results.
Okay. But you did see results it's like, I know this doctor can help me just in a short period of time.
Yes,
Okay.
yes.
And can you tell everybody, how long have you been under care?
I've been under care with Dr. Barlow, I would say this is my third week, I believe.
3rd week. And how has coming into this clinic, how has it really changed your life?
It has changed my life tremendously.
Okay.
I'm now able to bend. I noticed this weekend that I'm walking faster. I noticed that I can go up and down my stairs without holding on to the rails.
Okay.
And when I'm bending, I notice that I'm not hearing the cracklings
And the grinding
of the
sound?
grinding. I don't
Right.
hear that anymore.
Right. Good. And if you could just kind of look in the camera there and just tell everybody that's watching you on TV today, if they had knee problems, I mean, what would you say to them about coming into this clinic?
I would highly recommend that you come and see Dr. Barlow and Dr. Mackey, because this procedure that he's offering, it works. It helps me, and I would say right now I'm on a scale. I would say I'm at about 95% of my need is healed. I mean, I am not advertising. I'm just telling the truth from what I'm seeing, what I'm noticing.
Right.
My knees are better, way better than they were when I first started coming here.
And I mean, you've been here, you see how many patients we see and how many people come in here with knee problems and back problems and foot problems. And so, but I want to thank you so much for spending this time. And you just never know, again, how many people that are at home that see this, that you just saying that how it changed your life.
It's changed my life tremendously.
Yes, ma'am. And again, what we do in our clinic is we guarantee results within 2 visits. We want to see results in 2 visits with this advanced neurological treatment system. And if we do that, we will see you as a patient. If not, we will not take you as a patient. And we're honored today to have Miss Allred here with us. And she's going to be talking about her chronic knee pain and the suffering that she was going through with her right and her left knee problem that she was having. So Ms. Allred, thank you so much for being here today.
Thank you for having me.
And how long had you had your knee problem?
Probably 10 to 15 years.
Okay. And
quite a while.
Yes, ma'am. And then how many doctors would you say you had been to for this?
Probably 5 to 6, probably even more.
Okay, but you know.
But I know that's what it's for my knee pain.
Okay.
Yes.
And then did you have any injectable? Did they inject you with
I
the
did.
shots? And then,
didn't help a bit.
Didn't and did
Didn't.
Okay. Well, usually I will say this in the defense of the shots. Sometimes they do.
it does.
And,
yes, it just didn't me.
The ones that I typically see, a patient comes in and they had a shot and the first one worked, and then the second one didn't do anything, and the third one didn't do anything, but nothing
Right.
happened.
Nothing happened with mine. So.
And what was it that really concerned you the most about this knee problem? What like fears or concerns did you have?
Well, I knew if I kept on going down the road I was going, I'd be in a wheelchair.
Okay.
I knew, because I couldn't climb stairs, couldn't walk to do much of anything.
Okay.
And I knew that I would be in a wheelchair if I didn't get something done.
And so you were headed to a wheelchair and nobody had an answer for you.
Nobody had an answer.
And I know that had to be very
I had
frustrating.
taken numerous pills and stuff to try to get where I could walk, and nothing even seemed to help.
Okay. And then, well, how did you hear about me?
I saw you on the Daily Journal, the back of the Daily Journal.
Okay.
And I said, well, I've got to go see him. He's the only one that can help me, I believe.
And were you the patient that came in when I was doing a seminar with doctors that had come in?
I
Okay,
was.
That's right. That's
I
right.
was.
Okay. And the reason is I give neurology seminars to doctors all over the United States. I've actually had doctors as far away as Italy and New Zealand that I've taught on how to fix these knee problems. And now that you jarred my memory, I remember that you were in here for that. Now, when you came in, and I did a neurological exam on you, okay?
Yes.
And then I remember saying something about, if I can help you, you'll know in 2 visits.
And
Okay?
I knew in one.
And you knew in 1. So that's, and again, I cannot stress this enough for anybody that's at home suffering with knee pain, is in 2 visits, I'm going to be able to rule you in or out for care and know if I can help you or not. And that, to me, that's just a powerful thing, to be able to look somebody in the eye and say, I'll know in 2 visits if I can help you.
Exactly.
And so how has coming in here, how has that really changed your life?
Oh, tremendously. Before I came here, I couldn't even walk hardly any. And now I'm walking, playing with my grandkids outside, getting on the floor with them. I even went shopping yesterday for 4 hours. That's something I haven't done in a while.
Yeah. Well, your husband might be mad at me for that.
Well,
but
we'll discuss that later.
But you know, that's the key thing is grandparents being able to play with the grandkids. And
Exactly.
I've got grandparents that come in here that tell me I can't go to my grandkids' ball game because I can't go up and down the stairs, and once I get there I can't stand up and move around, and so anyway, that's incredible. So
That's true.
if there was somebody at home that's watching this half hour to health and they had knee pain, just look in the camera, and what would you tell them about this clinic, and what would you recommend for them?
I would tell you, please, if you have chronic knee pain, come see Dr. Barlow. I know he can help anybody, and if he can't, he'll tell you he can't.
That's all right.
But I know he can help you.
Yes, ma'am.
So please come.
Well, thank you very much. And again, if you come into the clinic, I'll know in 2 visits, and you'll know in 2 visits if I can help you. So, Ms. Allred, thank you so much for being in here. You just don't know how many lives you've changed just by doing this.
I hope I have.
Yes,
I hope somebody will listen to
Yes,
what
ma'am.
I'm telling them and come talk to you.
Thank you. And today we're honored to have Ms. Hill. And Ms. Hill, thank you so much for being here with us. And Ms. Hill was suffering from right and left chronic degenerative knee pain. And I'm going to let Miss Hill tell you about her story. And so, Miss Hill, when you came into the clinic, how long had you been suffering with knee pain?
At least 3 years, severely.
Severely, and so 3 years of severe pain. And when you say severely, on a scale of 1 to 10, with 10 being so bad you can't stand it, where would you?
10 plus.
10, okay.
10
All right,
plus. 10
well,
plus.
I know when you came to the clinic, you were literally in crutches, correct?
Crutches.
And
I was using a wheelchair, transport chair sometime,
Okay.
and a walker at home.
Okay,
Yes.
so crutches, a transport chair, and a walker at home. Okay, can you tell me how disabling being in that kind of pain was for you?
I could basically I couldn't do anything.
Okay.
No housework, walking very little, just
Okay, so
immobile for almost a year.
Okay,
Yes.
and you're way too young for that.
Yes.
I think we can all agree with that. And so you come into the clinic, and you come in here literally with 2 crutches, correct?
Yes.
One under each arm.
Both arms.
And you come into the clinic, we do a neurological exam on you, we take x-rays, and then I go over a care plan with you. And when did you actually throw those crutches away?
Oh, less than 2 weeks after
Less than-
I started.
Okay.
With
and,
you.
And as far as I know, don't tell me if I'm wrong, but I hadn't seen you with crutches or a walker or anything since then.
No, not since then. I haven't used
Okay.
a
And-
walking aid since then.
Okay, and I mean, how would you categorize these kind of results that we're getting in here?
It's the best thing that ever happened to me. That's the only thing I can say.
And one of the things that I want everybody to know at home is Miss Hill was also set for surgery, correct?
Knee replacement.
Knee replacement surgery.
Both knees.
And both knees, and she comes into the clinic and she goes back to her doctor and says, "You're doing so great that," what did he say?
At least 10 more years.
At least 10 more years, I don't have to worry about it. And so you came in at a 10 plus in pain.
Yes.
And then where would you say on a scale of 1 to 10, where are you now?
Because I still have arthritis, maybe 1.5, 2.
Okay, all right, so nothing that's compared.
Nothing to severely that I cannot walk.
And how has coming in here, how has this therapy changed your life?
Tremendously.
Okay.
I'm active now. I can do my housework. I can shop.
That's important.
Yes, it's
Yep.
the holidays, and
Yes,
so
ma'am.
I'm just thankful to the Lord for leading me
Yes, ma'am.
to you
Well,
all of you.
I thank you for being in here and giving me the opportunity to change your life. And
right.
if somebody was at home watching TV today and they had chronic degenerative knee pain in crutches, and what would you tell that person that's watching you right now?
Come to see Dr. Barlow. That's all
Okay.
I can say. And he helped me, and I just think it would be beneficial to anybody. It's worth your time, effort, money to check it out.
Yes, ma'am. Thank you. And again, in our clinic at the Chiropractic Neurology Center of Tupelo, if you suffer from chronic degenerative knee pain, I need 2 visits to rule you in for care or to rule you out for care. And that's why I tell patients all the time, we guarantee results in our clinic with knee pain in 2 visits or we don't accept you for care. Miss Hill, thank you so much for your time and have a great day.
Thank you.
Yes, ma'am. And I want to thank everyone for tuning in today for our half hour to health. And I would like to thank my patients who did the testimonials. And thank you very much for being here today. And if anyone's at home and this actually struck a chord and you're like, I have this pain, my pain is intense, it's severe, it's destroying my life, you need to call our clinic at 844-1414. Be sure and tell my staff when you call them that you saw me on the half hour to health segment. The reason for that is our normal startup is $450, but since you saw me here today, tell my staff that you saw me on TV and we will discount that to $60. That includes a neurological exam, x-rays, and you get the guaranteed results within 2 visits or I don't accept you for care. So again, I go back to guaranteed results in 2 visits. We're going to rule you in for care or rule you out for care, and how safe is that? 2 visits to know if I can help you or not. Thank you very much. This is Dr. Andy Barlow with the Chiropractic Neurology Center of Tupelo.